Good morning, everybody, and welcome to Mile High Living. I'm Gina Bellich. Millions of Americans suffer from persistent or chronic back pain, and as a result are limited in everyday activities. Plus, more than 20 million people have been estimated to have some form of peripheral neuropathy. Dr. Brad Richardson and certified nutrition therapist Amy Richardson are here with us today and tell us really how they can free you from chronic pain. This is a serious topic. This is something when you're in pain, I mean, you can be to a point where you really can't do anything. You don't want to talk to people. You don't want to do anything at all. So let's talk about the different types of conditions you treat.
Yeah, so we specialize in treating chronic pain, and our specialty is getting patients' quality of life back. Because you're right, patients come in and they're not happy, they're hurting, and it's just so great to see their attitudes change once we tell them that we can actually help them. But the conditions that cause these pains are herniated discs, bulging discs, sciatic nerve pain, pain or numbness radiating down your arms or legs, arthritis in any joint in your body, and then, as you said, neuropathy, which is a devastating disease that causes the nerve endings in your feet to die, and it is so painful.
A lot of people, when they're in this much pain, they do go to prescription medications to try to ease some of that pain. Is some of what you do an alternative to those type of prescriptions? Absolutely,
yeah. So the prescription drug or even the over-the-counter drug is just masking or Band-Aid. It just masks the symptoms. So the problem still exists. So we're focusing on specializing on getting rid of that problem with long-lasting relief.
Now let's talk about a laser you guys have. Talk about this laser. How does it work, and really how does it help your patients?
Yeah, so the laser is what we're using to stop the pain in these patients, and what the laser does, it penetrates a good 3 or 4 inches deep. It creates new healthy cell growth 3 to 5 times faster than normal, so that actually heals the tissue. It also decreases pain chemicals, and so it stops the inflammation and helps with the pain control. Breaks down scar tissue, which is very important for these patients who have had surgeries that haven't worked, and then increases blood supply, and of course blood carries the nutrients to heal, so it actually promotes healing.
Isn't technology amazing?
It's amazing.
I'm just so glad that we live in the century we live in. This is so nice. You have so many happy patients. Let's go ahead and hear from one of them.
And since I've been coming, the whole staff, makes me feel like they care about what's going on with me, that they want me to get better. And from the x-rays and stuff that they seen and took, they're like, wow, this lady really is messed up, and we're gonna do our best to make her better. And it just makes me feel so good with the way they treat people and how they interact with their patients, and the things that they do. They go out their way to help people, and it's just fabulous. I've never been to a doctor's office, a clinic, nothing, where the people are just so dead set on making sure that the way their patients walked in, they walked out on top of the moon.
I love this.
Love Juanita.
She's wonderful. You'd never know she had been in any sort of pain at all. Her attitude is so wonderful. So I guess a lot of people, obviously, if they're already in pain or have been living in pain, many who are probably watching right now are thinking, but is going through this procedure painful? What's the case?
That's a great question. Our patients actually love it. They say it feels like a warm, stone massage. The laser gets really hot and very comforting and soothing to the patients.
Now, is there any downtime, or do they have to take off work to do something like this?
No, there's no downtime at all. The patient comes in, we get them treated, and that's actually a relatively quick treatment. And they're out the door and they're driving. There's back to work or doing whatever their activity is. There are some restrictions that we do put on them. We don't want them necessarily, if they've got a bulging or herniated disc, lifting certain things for a certain period of time. But for the most part, it's pretty seamless, no downtime.
Oh yeah, you don't want them going hurting their back
exactly.
again. After you've got them all fixed up and feeling good, you don't want them out there doing heavy lifting again, right? All right, Amy, this is where I love to talk to you, and this is really talking about some of the other services that you guys offer, because it's not just this pain relief that you have, right?
Right. So really, inflammation is the crux of all disease and also pain. And so whether you're suffering from weight gain or even allergies and stress, I think we're all a little stressed right now, we can help with that. A lot of times we find once we do blood work on a patient, which we do phlebotomy in the office, we're able to read the labs in a little bit more thorough way so that the patient can really understand they're not crazy. They're not just normal, their blood work isn't just normal, they're actually suffering from maybe a hormone imbalance. So we're a medically integrated practice, meaning we have a nurse practitioner on board who assists with bioidentical hormone therapy, really getting people a lease on life again and getting them thriving, not just surviving or being told you've got to be on this medication the rest of your life or there's nothing we can do for you. We're kind of that source of hope, is what I like to think of, for someone who's just kind of been beaten down and gone through a lot of red tape to find out, wow, there really is an alternative for me, not just medication and not just suffering.
You know, I love that hope, because that's exactly what I was just about to say. It's one of those things, if you have been in pain for a long period of time, or you just don't feel like yourself,
Right.
you know, maybe something is just a little off. It's nothing that they've done or not done. It's just all of a sudden you're just like, oh, I'm just not feeling like me, you know? Yeah. I love that you guys have solutions for them. We appreciate you being here today. Thank you so much, guys.
Thank you,
all right.
Gina.
Experience relief with the team from Summit Medical Care Center. Now get this, the first 25 Mile High Living callers will receive a full exam. You will also be able to get an in-depth consultation and 2 treatments for only $49. Call today at 720-500-PAIN. That's 720-500-7246. You can also visit them at summitmedicalcc.com. They paid for today's segment, and we'll be right back.